Broadcasting from Watts Creative Studios and live on Grove Street FM. You're listening to Talk Local to Me, brought to you by the Central Virginia Business Coalition.
Good afternoon, everybody. I'm Heather Alto with the Central Virginia Business Coalition, and you are tuned in to Talk Local to Me. My esteemed co-host, colleague, Mike Norfield, could not be with us today. I think he's in like Denver. He's in Colorado doing fun things out there for visiting angels. I don't know exactly what he's doing, but I've seen a couple of his Snapchats and it doesn't look like he's doing much. Haha, just kidding. But he's learning a little bit more about how he can help make visiting angels better here in our Lynchburg area. And as you guys know, Mike works really hard. So I'm going to even say I'm going to miss having him here today. But if, he doesn't hear this podcast, I'm not going to, actually admit to it. So, But next week, we will actually not be live here in the studio. Just to give you guys a heads up, I will be out taking a much needed vacay with my family, as will Mike. I guess, being in Denver isn't enough. He's going to take another week. So, but we do have a great episode for you next week. We pre-recorded. We will be talking with Courtney and Sarah with Love Heals, which is a local nonprofit in our area that does some amazing things for, business, not for business, but for people in the community. And you're going to want to tune in and listen to what they have going on and a challenge they have running for this month that we want everybody to participate in. So before I get with my guests today, we have two guests coming in, and really interesting. We're going to be talking about health and wellness. And then I kind of think like my second guest we're going to be talking about, she's a local crafter artisan who has some amazing soaps and body scrubs and things like that. And I kind of look at that as health and wellness in a way, because it's a healthier version of like the soaps you just go and get off the, walking into your local Walmarts and just grabbing the soaps with the, I feel like some of them have chemicals, like they're supposed to like keep you clean, but I feel like they're kind of chemically and, anyway. But we're going to be chatting about that today as well. A couple of quick updates, though, for y'all. As you know, I love to talk about events that the CVABC has coming up. If you are a business owner out in the area and you're looking to connect and network, we have a couple of events for you this week and next. We have our Coffee Talk in Appomattox tomorrow. We are going to be at the beautiful venue 1848. It is right there off of Church and Main in the town of Appomattox. Gorgeous venue if you're looking for somewhere to host an event or a group session. They also use it as an Airbnb, so you can even look into it if you need somewhere to stay in the Appomattox area or have family coming in that need somewhere to stay. But we will be there tomorrow from 8:30 to 10. And then next Friday, we have our Lynchburg Coffee Talk, which will be hosted by two local retail stores in the Graves Mill Shopping Center area, and that is Scrub Connections and Blakely Bath. So we will be at both of those. You'll be able to kind of go into both stores and see what they have and network. And I've talked about it before, the importance of networking and getting out and meeting people and building relationships with other contacts and business owners in our community. So Coffee Talk gives you a great opportunity to do that. And then lastly, I'm just going to put out, while it's not until August, we are currently accepting bands for our Battle of the Band event that happens on August the 17th. So if you're out there and you're an aspiring musician and want to come out and play for the opportunity to win $1,000 cash prize, you need to let us know. You'll contact Autumn Myers, our event coordinator, at her email is autumn.myers, that's MYERS, autumn.myers at cvabc.org. So honestly, though, not a whole lot of events coming up right now, which is nice. And I don't know about the rest of you guys, but today is Wednesday, but it has been like a Monday. You like the song? Monday. Anyone? Okay. Where's Mike so he can laugh at my stupid jokes? But so this whole week has been crazy. I think it's just because I'm going on vacation, so everything gets stressful and nuts, and it seems like it's all going to crash down and before you get to actually go relax. But I probably need to really listen hard to my first guest about health and wellness and how to keep myself healthy and not go crazy. But I am excited today to have Brian Eckert with us on the show, and he is with Mighty Well Health. How are you, Brian?
I'm incredible.
That's great. I'm glad you are incredible today. I came in and he's like, I'm incredible. I'm like, I'm here. That's how it is today. Brian is working with navigating the challenges of healthcare and healthcare costs. And tell us a little bit about Mighty Well Health, just kind of an overview, and then we'll kind of dig into, all the different things that go along with it.
Okay, so Mighty Well Health is on a mission to transform healthcare in America. What they do is they seek out the best kinds of healthcare coverage and provide that coverage to families and businesses. And most people think when they think healthcare, they think health insurance.
Mm-hmm.
And unfortunately, you can put a does not equal sign between those because health insurance does not equal healthcare.
Okay.
So what Mighty Well Health does is they start with what is in the best interest of someone's health and then builds a program to help navigate the cost of that healthcare so that it's affordable.
So I feel like right now, people that are listening really should listen hard and be prepared to contact you, because when I think healthcare, health insurance, any of those things, you immediately think not affordable, hard to find, all those sorts of things, especially in the last 4 to 5 years. I would say it's gotten even worse, maybe, especially for small business owners. A lot of them can't afford to provide healthcare coverage for employees. And you see that on the back end where then you have the loss of employees because nobody, everybody wants to have benefits, and it's hard to do that if you're a small business. And even, as a family wanting to, having to go into the marketplace and choose your own coverage, and people just don't know. Like, it's hard. Like, they get in there and they're looking at all these plans and options, and it's kind of scary.
So I've been educating myself on this for years, and I go on and I get confused.
Yeah.
And I think, I have a lot of knowledge. I don't know everything, but I have a lot of knowledge, a lot of experience navigating these things. And I still get confused by some of the plans and how they work. And it's tough. So, and it has gotten more complicated, not less complicated, to not only understand what you're signing up for, but also what care that will provide and what cost it will cover. So it's really, a lot of people walk into it blindly. It's like throwing a dart at a dartboard and hoping that if something happens, everything's going to be okay.
Okay. So for the sake of understanding, let's chat a little bit about the different terms. So health insurance is not the same as health coverage.
Correct.
Which is not the same as health care.
Correct.
So what do those three basically mean?
Okay, so I brought notes from my ebook.
Okay,
so that I could read the definitions directly from healthcare.gov. So health insurance is a contract that requires your health insurer to pay some or all of your healthcare costs in exchange for a premium.
Okay.
So that's health insurance. Health coverage is the legal entitlement to payment or reimbursement for your healthcare costs, generally under a contract with a health insurance company, a group health plan offered in connection with employment, or a government program like Medicare, Medicaid, or Children's Health Insurance Program, which, the acronym is CHIP. What's interesting is the term healthcare is not in the glossary on healthcare.gov. I thought that was kind of ironic. You can't find healthcare in the glossary of definitions. So I had to go out to the dictionary for that. And healthcare is efforts to maintain or restore physical, mental, or emotional well-being, especially by trained and licensed professionals, or the field concerned with the maintenance or restoration of the health of body or mind. So those are the differences between those terms.
Yeah. And I think a lot of people just lump them all together in one big lumps, when they think of it. So it's nice to kind of figure out what they mean so that when you're out talking about it, you don't sound like you don't know what you're talking about.
Well, it's unfortunate because people do use them interchangeably, and people think, well, I have health insurance, so I have health care. And it doesn't mean that you're going to be healthy, nor that you have access to the care that you would need because of the way and the structure of how things are put together.
Okay. So let me ask you, is health insurance the solution to better health care?
Absolutely not.
Okay. I thought you were going to stick with absolutely at first, and you see the not in there.
No, absolutely not.
Okay.
So, like the definition says, it's a contractual agreement to pay all or some of healthcare costs, but it is definitely not healthcare. And, some of the things that have happened in recent years, like you said, it's more challenging to navigate this. But more and more, you probably are familiar with this, or I'm sure our listeners are, you have an issue, a health issue, and you have to get, permission before you go see a specialist.
Right.
So
you have to have that pre-auth.
Exactly. And so more and more, the doctor's recommendation isn't always what you're able to do because you have to get pre-authorization. And if the insurance company says, well, we're not going to pay for it, you could still go and do that. But the insurance company has basically washed their hands of any financial obligation.
Right.
So it is not about healthcare. It is a business.
Right.
And it is not a business that is concerned with healthcare. They're concerned with profit.
Well, and a lot of times too, they delegate where you can get services done. It's not necessarily who you may want to see or who you feel is the better doctor, but it's who was within your network in your coverage area. And I talk about this, and I know I've said it on the podcast before. So I used to do healthcare billing. So I get a lot of that, and I've seen a lot. And, I always tell you, you're talking about health insurance, that's when I'm a strong believer. So I'm gonna say it again for everyone who knows I get on my soapbox about it. Check your explanation of benefits when you get them in, your EOBs, because, there's different allowables your insurance provides, and, your healthcare, they cannot charge you more than what the allowable is from the insurance. So I always tell people to check that piece of it.
Yeah. So I actually brought a couple books that I've read. And the one that I like the best is The Price We Pay. And it's by an MD, Marty Makary.
Mm-hmm.
And he talks about exactly what you just said about the cost of things. And it's interesting because you brought up networks.
Mm-hmm.
Most people's first question is, when they're looking at a certain provider for health care coverage or health insurance, is they want to know, is my doctor in the network?
Mm-hmm.
Or when they go to a doctor, they want to know if that doctor is in the network. And so you've got to pose the question, are networks beneficial?
Yeah. I'm not answering yes. I'm thinking, yeah, okay. You got to ask the question.
Yeah, you got to ask the question. Like, are networks beneficial? They are, but not to the end user. They're beneficial to the provider of the insurance.
Mm-hmm.
Because if you really, and this information is hard to come by, but if you are in a network, the insurance companies, the BUCAs, the big insurance companies, what they do is they want a discount on the published price. So they may say, and I'm just throwing out general numbers for understanding. So they may say, we want a 50% discount on this procedure or this kind of care. On the billing, we want a 50% discount. So then what the providers do, the actual health care providers, the hospitals, the outpatient, whatever, they inflate the cost.
Yep.
So that the 50% discount then brings it down to a more reasonable kind of fee. So an example is a gentleman that is on one of our plans. He hurt his shoulder and he went in for shoulder surgery. They said it was $79,000.
Mm-hmm.
So our advocacy team called in and said, we're going to pay upfront for the surgery, cash price. It was $29,000. So it was a $50,000 discount on a $79,000 bill because you simply said, I'm cash paying. So it's the Price We Pay by Marty Makary. I recommend it to anybody that wants to understand how billing practices work, because it really gives an understanding of it and how you can navigate it better for yourself.
Okay. I haven't read it, and I probably will now read it.
It is incredible. I can also help with that, obviously.
So I'm getting ready to ask you the question that I already know the answer to.
Okay.
But is health insurance affordable? You just tell me.
No.
Yeah. Okay. That's kind of what I was going with, but I wanted to hear you say it.
So, and a couple of things you need to understand when you go onto the marketplace, depending on if you get a subsidy or not, it may or may not be affordable on a monthly basis. But then You have that coupled with high deductibles. And then after the deductible is met, you have copays. And then after the copays are met, then you get an out-of-pocket maximum. Once you reach that, you're okay until the next calendar year and all of it resets. So you've got to do it all again. And, just some examples to make this, more concrete. I know a young lady that went in to have her baby on December 30th and stayed over until January 2nd because of, some complications. She had to hit her deductible twice.
Yep.
Because it went over the calendar year for one incident. And that's not about healthcare. That's about profit.
Yeah.
So, and is it affordable on the front end? Well, look at some of the premiums that people are being asked to pay. It's not.
So what are I know a lot of people, talk about like the tax credits and stuff on healthcare.gov. What are the challenges with that people are seeing?
The biggest challenge is when somebody is self-employed and their income can fluctuate, because you've got to go in and basically predict what your income is going to be for the next year. And that's what your subsidy or your tax credit is based on. If you, throughout the year, if you're making less money than what you thought, you can go in and readjust it, but it's always backward looking. And what it's based on is forward looking to the end of the year. So if you overpay during the year, you will get some of that money back. But if you underpay, then you have money due when your taxes are due because you took too much of a subsidy.
Okay. I'm going to have to process that a little bit more, but yeah.
You have to have a crystal ball and look forward.
I gotcha.
If somebody is a W-2 employee and they know their healthcare is not provided through their employer, and they know exactly this is what I'm going to make because I'm a W-2.
I got you. Yeah. Okay.
Or I have a set income. It's not that bad to navigate. So as far as understanding, what the tax credit would be, what your monthly cost is going to be. So once you get past that, then you still have all of you're asking about affordability. That's just the monthly.
Mm-hmm.
Then it's on the back end. If you have to use it, is it ever, is that affordable? And that's a whole nother discussion. But
if you're a contractor or a 1099, you're self-employed, it's harder to do that because you're not quite sure what your profitability is going to be.
Extreme
moving forward. Okay.
And if you underestimate or overestimate, if you underestimate, you're paying more throughout the year and you will get some of that back on your taxes. But if you underestimate and you go through the year, you will have to pay extra when your taxes are due, because that will come back saying, well, you didn't qualify for this much of a tax credit on your monthly premium because your income was higher than you estimated.
Okay. That makes more sense. Thank you very much. I had to like hear it in my own brain while I was, listening to you talking. But so I know that I think everyone can agree that healthcare should be about better health and for yourself and your family and everything like that. How do you someone just listening in today, how do you go about choosing? How do you go about trying to find that better healthcare for yourself and your family, or even your employees if you're a small business owner?
Yeah. So there are several alternatives to, I'll say, traditional health insurance. And one of them for small businesses, and this is generally reserved for much larger businesses, but because the marketplace has become so competitive, these plans are available for smaller companies with less employees. And it is a self-funded plan. Now, for a lot of small business owners, when they hear self-funded, they're like, I can't do that because I can't afford to pay for all of the healthcare cost for my employees. Mm-hmm. But what they don't understand is if it's built in the right way, a self-funded plan is built in the right way, they've got reinsurance on the back end. So their exposure is capped. But what that does is it allows the employer to provide healthcare solutions to their employees and save money on that initial monthly cost and limit their exposure on the back end, not if, but when the employees have to use it, especially if something major comes in.
Okay.
The other thing that, you can, and the large insurance companies will offer self-funded if somebody asks for it, but it's not usually what they lead with because it's not as profitable for them. So one thing that Mighty Well Health does is we'll start with a self-funded plan with reinsurance, but then what I really enjoy is customizing it per employee with different things like MEC, which is minimal essential coverage plans with an HSA, or a MEC copay for all preventative, and couple that with a health share, and that can reduce employers' costs by 40 to 60%,
Okay.
which is significant when you're talking about this area, this arena of expenses to an employer.
Yeah. Yeah. And I mean, and that also gives them an option of having something to offer to their employees versus, what a lot of small businesses have right now, which is nothing
Yeah.
because they can't afford it or they think they can't afford it and maybe aren't, realizing there's options like that can help them.
Yeah. Another option, I don't know if you're familiar with this, but direct primary care
Yes,
practices.
we are.
Okay, you're familiar?
Yeah, we actually, so we have, we work with Kaya
Okay.
Health.
Mhm.
We have a plan for some of our members where Kaya Health does a discount for CVABC members to utilize them for insurance or not insurance purposes because they don't even take insurance.
Exactly.
So it's more or less an opportunity for our members to have health care here in our area. Did I use the right thing? Health care, right? Okay.
Yeah.
Health care in our area without having to worry about having an insurance, and they just pay that monthly. I always say it's like Netflix for doctors or.
Yes. And some of the advantages, and I don't know if Kaya is currently accepting new patients. I know that Forest Direct Primary Care with
Yes.
Dr. Jeff Ponke,
Yep.
his practice is because he's newer to the area and he's still building up his practice, but they limit the number of patients so that extra time can be had. And when you think about, health care, being able to have a consultation with a doctor that takes time with you, that gets to know you over time, and being able to see them as many times as you want for a monthly fee, which is a lot lower than what most people would think that would cost, because in their minds, they're thinking of the insurance premium and they're thinking of, well, when I go get this test, it costs this much. People, if they want that sort of concierge, medicine practice,
Right.
and that consultative with a doctor that gets to know you, direct primary care is a wonderful solution for that.
Yeah, I'm a big supporter of it. And I feel like that's kind of the wave that a lot of places are going to start seeing more of those pop up in our area, just because, I feel like you're getting, better health care. You're, like you said, you're getting that attentiveness. It's not a doctor coming in where they're only allowed to have so many billable hours, so many minutes in a room, and they have to go to the next patient, the next patient, the next patient. And I love the fact that you can even do like, phone in and call them after hours, or you can do a chat over your phone with them, and you don't necessarily always have to be there, but it seems easier, I guess is the word I'm kind of looking for. And I know for me, like when I call into my daughter's doctor and they're like, oh, well, we can't, call in at 8 and you might get a walk-in appointment, or, you got to be on the phone line so you can get her in. Then you call and they're like, oh, yeah, we're booked for the day. We can't see her until like 3 days from now. And I'm like, well, she's sick. Like, what am I supposed to do? It's frustrating.
Yeah. And talking to, the different direct primary care doctors in the area, they are very good at communicating what they can and can't do for patients. So what a lot of patients who go that route will then also have many people do a health share in conjunction with that to take care of major medical costs. And, are you familiar with health shares?
No, that was going to be my next question.
Okay. So health shares have been around for a while. They're not health insurance, but it's a collective where people pay a monthly share in, and then major medical expenses are then paid for. They're shared by the community, by the members.
Okay.
And it is a great alternative to health insurance, especially for major medical. because of my own experience, I found out that not all health shares are created equal. So you still have to be aware of what they do and don't cover. And I didn't realize that they had networks, the one that I used to have,
Mm-hmm.
and I ended up going out of network for something and didn't realize until I got the bill. And so I'm still making payments on that medical bill.
Now, with health shares, is that something where like you pay for it and you submit your receipts and get reimbursement, or how does that work?
Depending on which health share
Okay.
it is and how they do it. That's why I say not all are
the same.
created equal. So
Okay.
some you prepay, so you do have to come out of pocket, and then you get reimbursed for that. Some of them will advocate for you beforehand to get a cash price because it is not insurance. So when you present, you say I'm a cash payer. There are some that will actually prepay.
Okay.
So if you have a procedure coming up, there are some that will advocate to get the cash price, and then they'll actually send payment to the provider prior to you even going in,
Okay.
which makes it a lot easier for the person in recovery to not have to worry about making sure all of the receipts get in. And then if there are any other receipts that come in afterwards, they can certainly send those in and they'll be paid or reimbursed.
Now, would you encourage people that are maybe already using the marketplace to go in and kind of relook and reevaluate every so often what their coverage is or what they're paying? Is that someone that would be, a good referral to you, like to have them come in and have you look at what they've got?
Yeah. So open enrollment, if somebody is in the marketplace right now, there's an open enrollment, time near the end of the year. So that's when they can go in and really revisit, what they're paying, what their coverage is and things. So if somebody asked me to work with them, I don't have to wait till open enrollment. We can certainly do something now. And open enrollment does not mean that you're obligated to keep that coverage until October or December, to the end of the year. But what is really probably the sweet spot for me is somebody that is looking for something other than traditional insurance.
Okay.
So they want to be actively involved in their health, and they're looking for ways to stay healthy and keep it affordable.
All right. So if someone's listening in today and they want to get more information from you so that they can, maybe set up a time to meet, what is the best way for our listeners to get in touch with you?
So the best way is I do have a form on my website and the URL is at the bottom. So should I just read it?
Yeah, go ahead.
So it's www.brianeckert. So it's BRIANECKERT.info/healthcare-interest-page.
Perfect.
So if they go there, it's just simple first name, last name, email address, phone number, and whether they're looking for coverage for a business. So maybe they're a business owner and they have employees, or personal just for themselves or for their family. And then someone will be in touch with them.
Okay, wonderful. So Mike isn't here to ask, but we normally ask 2 questions to all of our guests and put you slightly on the spot. Hold on, let the train likes to drive through at the most inopportune times. But so the first question is, how long have you been a member of the Central Virginia Business Coalition?
Total over 4 years.
Yes, you are correct. Ding, ding, ding. No, I'm just kidding. It wasn't a quiz. It wasn't a quiz. And then our second question is, what do you find as one of the bigger, best benefits of membership? And Mike likes it when people say Heather. So you can start with that and then roll into what the next thing is.
So if I said Mike?
No, you could say Mike. No, Mike's pretty cool.
It's really the connections, and
Yeah.
the opportunities to connect. So the different coffee talks that you have, and different opportunities to meet other people in business owners, other outside salespeople. It is a great opportunity to learn about other products and services that are available in our area and to build relationships with those people, because I'll give an example. I won't say names, but I met somebody at a coffee talk and I've already referred 2 people to them.
Awesome.
Because I was like, this is perfect. And it's a solution that I can't provide.
Right.
So that I think is the best benefit.
Very cool. Well, thank you so much for joining us today, Brian. I appreciate it. And again, if you are listening in and you want to just, have a chat with him about your health care, your health insurance, your health coverage, because they all mean different things and you need to probably, check that out. Contact Brian. Again, you can go to his website, www.brianeckert.info/healthcare-interest-page. We are going to cut to a quick commercial about Visiting Angels because, of course, we miss Mike. We need to play a commercial, and we'll be right back.
Visiting Angels, America's Choice in Home Care, is now serving Lynchburg and the surrounding counties from their new location at 2201 Linghorn Road, providing our community with personal care services, including assistance with bathing, dressing, meal preparation, grocery shopping, light housekeeping, and much more. Our trained staff have to pass all of our requirements for a high standard of care, ensuring that you have a compassionate, kind, and qualified caregiver. Our office team works with you as a partner in providing care for you or your family member to make the task of starting and continuing care an easier process. At Visiting Angels, we understand that every individual is different. That's why our team of dedicated caregivers is committed to providing tailored assistance to make you happier and healthier at home. Call 434-439-4698 to learn more about our services and schedule a free in-home, no-obligation consultation. Trust Visiting Angels in Lynchburg to bring peace of mind to you and your loved ones.
Visiting Angels, America's Choice in Home Care.
All right, welcome back, everyone. And if you, liked that little commercial Mike, did, you can be a podcast sponsor. We are always in need and want to get your name out. It's one thing, we have guests on the show, but there's also opportunities for businesses to get their name out. This, while we are here live and we have a bajillion listeners, sometimes, after this is over, it gets uploaded to wherever you get your podcast. So it's listened to over and over again. So it's a great opportunity. It's only $100 a month for you to have a commercial, each week for the month. And contact me at heather@cvabc.org if you are interested. We can do a host read by myself or Mike, or we can even have you come into the studio and record your own podcast. So would love to have any of our local businesses that want a little bit of an extra push out into the community to let us know so that we can do that for you. All right. So I am now joined in the studio with Leah with Little Daisy Soaps. How are you?
I'm great. Thank you. How about you?
I'm good. So I, first of all, just want to say, I have not physically had the chance to use your soaps or anything, but I was looking on your website and you've got some really great products, and we're going to dive into those in just a little bit. But I wanted to start off by kind of finding out a little bit more about you and the business and how it got started.
Okay. Yeah. So I think the first thing that most people find surprising about the start of my business is that I actually come from a background of veterinary medicine.
Yes, I saw that.
Yeah.
And I didn't know that about you until I was looking on and I read about it and I said, okay, that's interesting.
Yeah. So you kind of go on the first page of my website there and you see that picture of me with the bear. Mm-hmm. It's like, whoa. So yeah, I had over 20 some years experience in veterinary medicine, and just, kind of things changed in my life. And, veterinary medicine is just kind of emotionally can be a draining line of work over time.
Right.
And as things changed, I kind of moved away from it and was just kind of looking for something else to do, just something that I could have more flexibility with my time and just be looking for something else. So I started looking into making soaps and making body products. And I just kind of really fell in love with the whole idea because I felt like I was still helping people. And I just really felt like I was still seeing that same happiness there, mm-hmm. kind of, with the products and with the way the experience people were having and the feedback I was getting, but just not quite so much on that emotional level, coming back home from work at night and just sitting on the couch
and being drained,
emotionally drained, where you just sit there and you're just like, just let me just
Mhm.
decompress for a while. So
I had a sister-in-law that worked in the veterinary field for a long time as a vet tech,
Yeah.
and she's been out of it for a while too. But I think that was kind of the same. She had the same concept. Like, it was just, she loved it,
yep,
but after a while, it was hard to
yeah,
keep going back every day, and
yeah, yeah.
it was challenging.
Yeah, it's really challenging, and just you love the job, you love your patients, you love the people that you interact with, but it just there's a whole aspect of it that's just very emotionally draining. So
Well, yeah, and when you're making soaps, people normally tend to just love soap because
They
they
do.
smell nice and you smell nice, and but when you have stressed out people worried about their pets and animals, and
Yeah.
something doesn't go right, then they're all they're yelling at you and they're fussing at
Yeah.
you, and I can
Yeah.
definitely see that. I would like to just say though, real quick, before we dive into the soap, like, what is up with the bear? Like,
The bear?
you don't see very many pictures of people cuddling bears and laughing, and it's so cute.
yeah, so that was a client that we had, and she's actually a very good friend of mine, but she
Like, that's adorable.
she had bears. Her father was, had, a history with some bears and stuff, and she had bears that she took care of, and, we would go and, just do wellness checks for her with
Okay.
her bears that she had. And
Makes
that
me
was,
want to cuddle one.
yeah, she had, at that time, she had little baby bears that were born. So we had the opportunity to be able to interact with the small baby bears.
So I wanted to ask you the story behind your name.
Yeah.
And how how you set on Little Daisy soaps.
So that's a good one. The story comes about from, I like to call my silent partner, who's actually my niece. Her dog's name is Lily, and I have a special needs dog named Daisy, which kind of comes about when you work in the veterinary field. You kind of get those special needs dogs. So my niece, her little dog, she adopted from, I think she was down in North Carolina, and my dog is Daisy. So as we were trying to come up with a business name, we were going back and forth, and my niece was going with one name and I was going with the other. So we just kind of then combined the names. We took the Lil, Lil, for Lily, and Daisy is, of course, my dog's name. So we have Lil Daisy soaps.
Okay. See, and that's another thing I love about small businesses is there's always some sort of, like, I feel like you have that relatable piece to it as well. It's not like, it's just, named, no offense, Amazon, because it's like, that's the name. But, there's always something, and it has more of that relationable feel to it. And you're doing it for yourself and your family, and you're working with, family. And I think that's really cool.
Oh yeah. My niece is like so involved. Like, she's always like calling me or texting me with ideas, thoughts about things that we should be doing. And it's so great to see her involved and just, putting thought, and, we talk about different aspects of the business.
And so I have not a creative bone in my body. Like, if I were to try and sit here and make up soaps or anything, I draw stick figures and do stuff like that. But, I do think though, for those who can do those sort of things, the creativity piece of it is one of the things I think would be the best, because you can really make up your own things and get, have those ideas and put them out there. Maybe it doesn't always work the first time, but you just keep working with it and make stuff your own. And I've always thought that was like one of the best parts of when I see all these artisans and crafters is the spins they put on them that are their own touches, and being able to have that creative license to do it.
Yeah. And I mean, there's, you run into, especially like when you do the vendor events, you'll see like different soap makers, but they always, everybody always has their own spin on, how they take something and do it their own way.
Right.
And it's unique and it's amazing to me.
And, and I love that you mentioned that, because we talk about that a lot on the podcast about, like, we call it co-opetition, where there's that collaborative, there are many people that do some of the same things, but they do have their own personal touches and their own spins on them, and maybe, create things differently. And, it's great that you, can sit here and say, yeah, we're at other vendor events with other soap makers, but there's differences to each one. And I think that's really cool.
Yeah, it's awesome.
So, I want to kind of start off talking with about the soap.
Sure.
Because your soaps, are they all made of goat milk, or are there different
So
types of soaps?
I would say in our inventory lineup, 90% of them are goat's milk.
Okay.
And we do have some coconut milk soaps. And the reason that we offer some coconut milk soaps is that I do have some clients, some individuals who are maybe looking for a vegan option on a milk soap.
That's
So
awesome.
We
Okay.
offer a coconut milk soap, and coconut milk is very similar to goat's milk in the properties that it'll bring to the bar. So we chose coconut milk to go with.
Okay. What are like the benefits of using goat's milk, or that sort of so versus
Sure.
what you just get, like you said, like I said earlier, from your soaps at the grocery store?
So I think the biggest thing is the soaps that you get from the grocery store. The misconception is that they're actually not really a true soap.
Mm-hmm.
A true soap is made with oils and butters, and then you use lye to go through the reaction process called saponification to then create your soap. Generally, what you're purchasing in the store is something that would be made from synthetic detergents. So
Oh, see, that doesn't sound good.
right. So
Yeah.
it's not, I mean, it's still going to cleanse. It's still going to have gentle cleansing to it. But it's missing those oils, those butters. It's missing the natural glycerin, which is a byproduct of the soap making process. The soaps that you get in the store, they're going to have that natural glycerin stripped out of it because glycerin is such a valuable product.
I would assume that's why some of those types of soaps leave you feeling dry and stuff after you use them.
Yep.
I get that a lot when I've used my husband loves the Irish
Yeah.
Spring, so we get that a lot. But like I will actually leave feeling very, very dry and scaly and stuff. And while you feel clean, you don't feel great. You don't feel good. Let's put it that way.
Right.
Like you still feel kind of like, ugh.
Yeah. A soap is going to cleanse you, but it should not be stripping the natural oils from your skin. It should not be stripping the natural biome from your skin. So like something like goat's milk, back to your original question, goat's milk is high in fatty acids. It's high in a lot of vitamins that are going to help to nourish your skin. It's going to help feed your skin, but it's not going to strip your skin. We're looking to make a bar that's going to not strip your skin. It's actually going to help feed your skin. If you think about your skin, it's the largest organ on your body.
Mhm.
It's the defense system. So we want to keep that defense system healthy and protect you.
How long does it take to make bars of soap? That's
a great question.
yeah, I've always wondered. Not because I can do it, because I'm not even going to try, but like, I see, again, I'm in awe of
Yeah.
you guys, the ones that can do. I just always look at it because I am, and maybe it's the ADHD in me too, but like
Yeah.
for me doing any long-term sort of projects, I'm just like, yeah, no, I'm out. But how long does that take?
So there's the process of making the soap, where you have your soap batter and you put it in your little loaf mold and you make the soap, and then you cut your bars. And that only takes, like if you were making, let's just say like a cake or something,
Okay.
it cures overnight there and you cut your bars. But where the actual long process comes in is where the bar actually cures. And that curing process is where your bar is losing its water weight and becoming a nice hard bar that's going to last longer in your shower. Depending on your formula, your bar is going to cure anywhere from 4 to 6 weeks.
Okay.
Some formulas may take up to 6 months to cure, depending on what type of soap bar that you're making. So it depends. It also depends on the weather. Here in Virginia, with some of the humidity, your bar may take a little bit longer to cure. So
Yeah. So this isn't just, Leah gets up each morning and makes soap and it's ready by the evening.
no.
It's a process.
Yes.
And I think, again, like, when I look at vendors who do vendor events and y'all come out with this product, and I'm going to just, again, because I'm all about supporting local
Mhm.
and shopping local. Like, guys, think about what she just said. The time and effort that goes into making
Yeah.
these products is well worth the extra you're paying. I always hear people go, oh, I can buy that in the store, for
Yeah.
$2 cheaper. Yeah, you can.
Yeah.
It's going to be less quality ingredients and, but you're paying for the time and the effort as well as the product. And I always like to point that out because I know it's not something you just get up and, oh, I'll just make soap today. It'll be ready to go.
Yeah.
So yeah, I just want to kind of ask that question and throw it out there.
And you're also paying for, the thought process that goes into the bar, because it's not just the same bar across the board. I mean, you're making different bars based on maybe what people have asked for. Different people ask for different bars for maybe different conditions. So there's a thought process that goes into your recipes.
How do you come up with your scents? Like, is it just random? You just play with different scents and like out they come,
Well, so that's
I want to try the butter orange. Is it patchouli? I'm looking on I'm on your website.
The orange. Oh, that's really that. I love that orange.
That looks like it would smell great.
So I tend more towards like the woodsy type scents. I tend to not be so much of a floral person, so I've kind of had to push myself into getting more of the floral scents.
Yeah.
The essential oils, blending the essential oils takes a little bit of practice, just coming up with those different nuances of the essential oils. I also put it out there to my followers, or when I'm at vendor events, I'm always encouraging people, hey, if there's something that you like, let me know. I'm always looking for new ideas. So
okay. Yeah, I was looking on here. I was like, I like that one. Yeah. I like that. Berries and cream sounds like good. That's the other thing with soaps. Half the time I want to you're not supposed to eat soap unless you've been bad and you're, back in the day when your parents could wash your mouth out with it. But, yeah. But you look at some of the flavors today and you're thinking like, dang, I wish my mom would wash my mouth out with soap with some of this stuff. It sounds good. So let's, I want to talk about, cause you have more than just soap. So you guys do body butters and lotions and scrubs.
We do scrubs, body butter, lotions. Body butters come out when the weather's a little bit cooler. Right now, they don't really like the hot weather. We do sugar scrubs, shower steamers, bath bombs. So we cover quite a bit. We have shampoo bars that are going to be coming out soon. We're just finishing up on doing some testing with those. So we run a pretty big gamut of what we kind of offer. So the lotions, those are made with shea butter. They have chamomile. Is it chamomile that I put in those? Yeah. Chamomile extract. They have a lot of hemp seed oil, which is different because I do get asked this question a lot. Hemp seed oil is different than hemp products.
Okay.
Because I do get asked if that has like the THC compound in it.
Right.
It does not.
Okay.
But hemp seed oil itself is really good for your skin. I mean, your skin just really loves the nutrients in hemp seed oil and the vitamins. So that's why I use that in there.
Okay. And then you also do wax melts. I was looking at that too. Yeah. So if someone wanted to get more of like the candle sort of vibe.
Without the flame.
Without the flame. Yeah. I do love wax melts. I have those all over my house.
Yeah.
But you do those too. So that's really cool. Now so you do vendor events kind of throughout our area?
I do. We also have, we are down at George's in Forest. If people want to go in and shop and, smell some of the bars and sample. I know they have some of the products available that you can sample. So we're down there as well.
Okay.
So we do wholesale accounts as well.
Okay, that's awesome. And one of the things too, I was on your website and I love the fact that you have like a soap quiz. Oh, and I was taking it. So like you can go on there and find like the perfect soap for you.
Yes.
And it kind of walks you through the steps because you're right, not everybody is the same.
No.
Different skin, whether you've got people that have eczema or, things like that. They may need to have, a gentler, type of soap.
Yeah.
So I think that's really cool. I don't know that I've seen that before on any other, soap vendors' websites.
I find that you get asked the question a lot, like, what soap would you recommend for me? And it's
right.
Well, what are you looking to address something? Do you have issues? Like what are you looking to do? Are you just looking to grab a bar to cleanse yourself? So I feel like that quiz kind of helps to help with that decision-making process.
Yeah. And I think sometimes even you as a person don't really know until you actually have it in front of you and you're thinking like a lot of going back to like the scents. I'm the type of person that like, I'll just walk by and be like, oh, that looks like it would smell good. Let me just use it. But, it may not actually be the best product for my skin type or, so I think, I love that. I think that's really, really neat. So now do you have any upcoming events that you're going to be vending at anytime soon, or how can people find you outside of going to George's? And for those who don't know, George's is the old Ehlers on 221, correct? Right on in Forest?
Yes.
Yes. The old Ehlers. Yeah. I know a lot of people get confused and you say George's and they're like, where? And I'm like,
Well,
it's Ehlers.
They're they changed the business name for
The cat. Yeah.
Yes.
The cat. Which I followed that cat story like when the cat was missing and all the things.
Oh, really?
Yeah.
Oh, no.
But yeah, so, aside from going there, do you have any like vendors events coming up?
So I think pretty much the rest of this summer we're going to be at the Appomattox Farmers Market.
Perfect.
And then coming up in the fall, and we always post like on either Facebook or Instagram where we're going to be. And then also if you join our email list, we send out emails with future events as well that you can find us. But we're going to be at the Amherst Apple Fest. We're going to do the Appomattox Railroad Festival. And I know we have more as we head into the
fall
season.
Yeah. Fall's the best festival season.
Yeah.
So if someone again listening in today, what is your website that they want to go on and purchase off the website? Because you do offer shipping.
Yes, we do. And we also offer local delivery. So if you're if you made a purchase, it'll give you the option if you're within our radius that you can choose local delivery.
Okay.
Well. The website is Lil Daisy, LILDAISY, soaps.com.
Okay. Awesome. Well, I'm going to ask you the same questions I asked Brian. And I know you are relatively newer to the CVABC, but how long have you been a member?
I'm pretty sure I joined in February, if that sounds right.
It does sound correct.
Okay, good.
Yeah, I believe it was February. So you've been for about, I can't count. I don't math, but 4 months.
4 months.
Yeah.
Yes.
I'm not good with the mathing on the spot.
Yep.
Now, so in the 4 months, what have you found kind of to be some of the benefits that you've used or that you see as beneficial?
Well, I believe I'm supposed to say Heather.
And thank you.
Yes.
See, Leah, thank you. See, Brian didn't do so much, but we got you here.
Yep.
Okay.
Yep. Heather.
Awesome.
And I would say also, just being able to, coming to the area as a new business and then also moving to the area as a new person, being able to meet and network with other businesses has really been wonderful. Everybody has been just so kind and encouraging, and it's just been wonderful meeting all the different business owners and meeting and talking to them. I've done the coffee talks mostly.
Right.
There's one tomorrow.
Yep.
That I signed up for this morning to go to, and they've been really nice just to attend.
That's one of the things I think I love about our membership. I say it all the time, and we have a lot of members, but like they're so supportive of each other, and that's what I really love, and they're encouraging, and and again, I go back to even those that do the same thing. I see them sometimes chatting, and oh well, how do you do this? And this is how I do this, and I just really do love that, and for small businesses, and even because I have a lot of people that are like, oh, I'm a crafter, I'm an artisan. Can I even participate? And I'm like, yes, you are a business. Like it's important though for them to get that same love, and whether you have a brick and mortar or not, I just love the support system. So I think
it's very supportive, which has been really nice.
Yeah.
And my husband, who's the silent part behind what you see here, but he's like just the brick wall that just keeps me going.
Yeah.
He's experienced it as well and has mentioned it many times to me, just how
awesome
supportive the other businesses have been.
That's awesome to hear. I love that. Well, thank you so much for coming on the show with us today. If you are, interested in, finding out more, please go to her website, littledaisysoaps.com, and check out the products that she has on there. Take your soap quiz, learn what's going to work best for you. Stop by George's, or, just kind of follow. She's a Facebook page as well.
Yep.
So follow that, and, that way you can see when she's upcoming in other places. So I will also mention before we go, because I forgot to mention at the beginning, we do have a ribbon cutting on Friday. If you want a fantastic, yummy grilled cheese sandwich, you are going to want to head out to the ribbon cutting we're hosting this Friday at 11 a.m. at the Backyard in Forest, where they have the food truck, kind of all the food trucks at. We are going to be with the American Melting Wagon. It is a grilled cheese food truck. Let me tell you, I had their All-American grilled cheese last week, which is like a smash burger and a grilled cheese. Is so good. So come out and visit them, grab you some lunch on Friday, and, kind of meet and greet with our other members that are there. Until then, we, like I said, will not be in the studio live next week, but we will be back on July 3rd to talk local to you. Until then, you can go to grovestreet.fm, listen to some past episodes, make sure you subscribe, ring the notification bell, and we will talk to you soon.